Hello, I'm Jonathan Dakin, Consultant Respiratory Physician in Guildford, and I'm going to show you how to use a metered dose inhaler the right way. This is a metered dose inhaler. It's the most commonly used treatment device for asthma. And if you're using this as your regular maintenance or preventer therapy, it's really important to use it through a spacer, which increases the amount of drug which actually gets into the lungs. This is an Aerochamber, one of the most commonly used spacer devices. You fit the inhaler snugly into the spacer like that, give it a good shake, take off the cap, and you put your index finger on the top of the inhaler, your thumb underneath, and now I'm going to show you in slow motion the steps to take. The next thing to do is a really deep breath out to empty your lungs before you use the inhaler. People find it a bit unnatural to breathe all the way out, but it's really important because if you start with empty lungs, you can take a much bigger breath in with the inhaler. Then put the mouthpiece between your lips and just start to breathe in very slowly. Then press the inhaler to trigger release while continuing to breathe in really slowly all the way to the top. This step's quite important, so I'm going to play it again in slow motion. Then finally, hold your breath for a full 5 seconds, ideally 10 in full inspiration. Then breathe out. The really important thing about using an inhaler is that if your technique isn't quite right, then most of the drug ends up in the back of your mouth rather than down in the lungs. And all the time we see people who are using their inhaler regularly, but their asthma isn't getting any better because the drug isn't ending up in the right place. Probably the most common mistake is to take the breath in far too quickly. Remember, the breath in needs to last at least 3 seconds, which is much longer than you think when you're actually doing it. This kind of spacer has a whistle, which sounds if you breathe in too quickly, which it did briefly on the demo. So if you hear the whistle, you need to slow down. Also, it helps to start the breath in before you trigger the inhaler. That helps to set the air in motion and carry the drug down into the lungs. And then finally, lots of people forget to take the breath out before they start. I wouldn't say this kind of inhaler's for everybody, because some people will find the timing tricky. But if it works for you, then definitely it's a good one. If it doesn't, then there's lots of other options out there. I've got more information about inhaler technique on the website guildfordrespiratory.co.uk. Thank you for listening. I hope you found this helpful.